Welcome to the 12th Annual Winter Ball, a night of celebration, stories, and giving. Tonight's broadcast will feature the stories of over a dozen frontline caregivers. UMass Memorial Health Care President and CEO, Dr. Eric Dixon. Special musical performances by a member of the Worcester Chamber Music Society, the lead vocalist of Santana, and a special appearance by a Grammy Award winner and Country Music Award winner. A special message by the Lieutenant Governor of Massachusetts, Karen Polito. Multiple giving moments. The Winter Ball live auction with auctioneer John Terrio, and a special mobile auction where you can impact patient care in central Massachusetts. And several surprise moments to inspire unmasking our champions. Thank you for watching, and welcome to the UMass Memorial Health Care Virtual Winter Ball. Please welcome UMass Memorial Health Care President and CEO, Dr. Eric Dixon.
Unprecedented, never seen before, crisis of the century. These are words we've been hearing the last 9 months to describe the turmoil caused by the worst public health crisis we have ever seen. Outstanding, exceptional, extraordinary. These are words that I have the privilege of hearing every single day to describe the 14,000 caregivers from across UMass Memorial Health Care who have been essential in getting us through this unprecedented, never seen before crisis of the century. As President and CEO of this amazing organization, it is an honor to welcome you tonight to our first ever virtual Winter Ball. I wish we could be together in person, but I'm grateful to all of you for joining us online. Tonight, we will celebrate and honor our caregivers who are keeping our community safe during this difficult time. And we have the opportunity to thank all of you for your unwavering support when our caregivers needed it the most. The theme of this year's Winter Ball is Unmasking Our Champions. We choose to use the word unmask to reveal to you the selfless sacrifice, heartfelt compassion, and relentless dedication that each one of our caregivers demonstrates daily, not just during a pandemic. And we choose the word champion because our caregivers are loyal advocates and defiant defenders who only want to protect our patients and the communities we serve from this dreadful disease. They are true winners, even though this fight is not over yet. During our program tonight, you will be hearing more about the heroic efforts of some of our caregiver champions. If you were to thank any one of them in person, I'm sure they would just say, I was just doing my job. But I'm also sure that when you hear these stories, you will come to understand what I know to be true, that an amazing group of people work at UMass Memorial Health Care, who have shown such humanity to the world at a time when humanity is exactly what we need. And they are why tonight's Fund a Need is so important. This year's Fund a Need donations go to what we call our EASE program, which stands for Emergency Assistance Support for Employees. Many of our own caregivers have suffered tremendous financial hardship during this challenging time. Well, I'm proud of the fact that we did not furlough or lay off any of our caregivers or cut any benefit. It still has been difficult for many of our employees to make ends meet, from the single parents who have struggled with childcare to those whose spouses lost their jobs. There have been many reasons why our caregivers have needed support from the EASE Fund. I hope you will consider directing your donations tonight to the Fund a Need program to help those on our front line of this tragic pandemic. They need your support. And now, I'd like to introduce what we have been calling our anthem video. It is a tribute to those caregivers I was just talking about. Those who have stepped up in one united purpose every single day to care for our patients and each other. Now let's watch that video.
It's been said that everyone stands for something. But the truth is, a fact of life is, that not everyone can always stand for themselves. There are times when circumstances can drive the strongest of us to our knees. And it's hard to stand when you're on your knees. There are times when a diagnosis can turn a family's world upside down. And how do you stand up when you're just trying to hold on? And when we find ourselves in unthinkable times, when it seems that the whole world is in need of a miracle, who stands up then? Who takes the reins and shows the world how to create miracles out of compassion, commitment, blood, sweat, tears, and team? We are UMass Memorial Health Care. We were built to stand for others, to provide the strength, the knowledge, the resources, the healing, the compassion, and cures to help those who need us, not just stand, but withstand even against all odds. For the child who has been diagnosed with cancer, we stand for hope. For the mother who's been told there is no hope of a life-saving transplant, we stand for life. For those who need help for which they can't pay, we stand up and we stand in the gap. Our mission is to provide everyone with the best we have to give. Our hearts, our minds, and the greatest medicine available in the world. For generations, we've delivered the community's babies and delivered for the region's infants who've needed the highest level of care. For decades, we've given second chances, standing beside those struggling with addiction, standing for those in need of emotional and mental support, providing the best of medicine's best when people needed us most. Today, we are a collection of some of the greatest specialists in the world. Men and women who specialize in every aspect of clinical care. People who specialize in kindness, who specialize in going the extra mile and doing the right thing because it's the right thing to do. Together, we form a special team that extends from Worcester to Leominster, Fitchburg, Clinton, Marlborough, and the region. To bring health and healing to the communities we serve and next-generation medicine to the world. If it can be done, we do it. If it can't, we change it, we create it, and make it possible. This is who we are. This is what we do. This is what we stand for. UMass Memorial Health Care.
Tonight, I would like to thank two long-term friends and business partners of UMass Memorial Health Care. Jack Shields, founder and chairman of Shields Healthcare Solutions, and Tom Shields, CEO of Shields Healthcare Group. These two organizations have helped us deliver high-quality care to the patients and families we serve in our region. And they are generously supporting the Winter Ball as our presenting sponsors this evening. Their support tonight and throughout the year means the world to our organization. Thank you, Jack and Tom, for your generosity.
Thank you, Dr. Dixon, and welcome everyone at home watching and here in the studio to the 12th Annual Winter Ball, our first virtual Winter Ball. Tonight we'll unmask and celebrate our caregiver champions. And the best way to do that, if you haven't already, is to start giving. There are several ways to give throughout the broadcast. First, we have partnered with Greater Giving again this year, and they are running our fantastic mobile auction and mobile giving opportunities. If you haven't had a chance to register to bid, let's do it now. First, let's pull out our phones or second device, click on the auction registration link, then click on the Get Started button. Follow the prompts to confirm your email address, create a password, and fill in your information. Time to browse the auction. Second, we have our live auction featuring amazing experiences around the globe and right in our own backyard. How about Oktoberfest, with Dr. Dixon and his wife, Dr. Catherine Jones, on their family farm, or a magical self-drive road trip down south from Charleston to Savannah. You might also bid for dinner for 12 at Polar Park during the inaugural Worcester Red Sox season, a vacation at a gorgeous stone house in French countryside, or the thrilling performance training Mercedes-Benz race car driving experience in California. All bidding for the live auction will be done through the mobile bidding site. The link is on the screen below. Live auction items are open and will remain open until 7:20, so get your bids in. Third, the mobile auction is also open and will be open through Monday at noon. Log on to the mobile bidding site anytime to start bidding. Last but certainly not least is our Fund a Need. This year's Fund a Need is dedicated to the EASE Fund, which Dr. Dixon talked about earlier. The Emergency Assistance Support for Employees Fund is more important now than ever. We really need you to open your hearts and wallets this year. So, you're going to start giving, right? We have curated some incredible stories to share with you this evening. Stories of the caregivers serving our community at every campus of the UMass Memorial Health Care system. So, let's pull on those heartstrings and meet just a couple of our amazing champions.
When Jonna Doobie first reported for duty in the emergency department at UMass Memorial Medical Center's university campus, her daughter Alex was just starting elementary school. Over the years, as she grew up, Alex was witness to her mom's dedication to her job and to her patients. She knew that Jonna helped people every day when she went to work, and she decided she wanted to do that too. Fast forward to 2020, and Jonna, now our Senior Director of Ambulatory and Procedural Services on the university campus, was thrilled that Alex was about to start work on the pediatric floor. But the pandemic had other plans for this new nurse graduate. With the graduate training program put on hold, Alex was assigned to help manage COVID-19 patients as part of the proning team. This team helped care for severely ill patients by carrying out the complex procedure of laying them on their chest, which increases their ability to oxygenate. Having a team specialize in this delicate task allows the critical care teams to focus on patient care and treatment strategies. Fearful or fearless, I couldn't tell, but Alex went without hesitation with an eagerness to help, said Jonna. I am filled with pride to see the spirit of nursing in her, the enthusiasm, the courage, and the willingness to help in any possible way she can. I see in my daughter what I see every day in our UMass Memorial family of caregivers. Thank you, Jonna and Alex, for 2 generations of living the Everyone Everyday mission with pride and dedication. We're grateful to have you among our many healthcare champions.
Like all healthcare institutions, Marlborough Hospital made significant changes to manage the COVID-19 pandemic and the surge of seriously ill patients coming through our doors. And there was one group of caregivers who took on a huge number of those tasks, our facilities department. Even when they were down 1 staff member, this team, Director Mike Williams, along with Hillary Grabe, Ed Doherty, Paul Lucas, Randy Dupuis, John Bernier, and Justin Perino, dug in and got to work, dealing with many new duties and the occasional crisis to keep our patients and caregivers in our communities safe. Among their critical tasks was converting patient rooms into negative pressure rooms that could safely accommodate COVID-infected patients, as well as selecting and installing new HEPA filters throughout the hospital. They were responsible for setting up the outdoor testing tents for our community testing. Along with having to build out an intensive care surge space in our post-anesthesia care unit, and set up another surge area in the emergency department waiting rooms. The team was constantly busy moving furniture, ordering equipment, acquiring and installing new signage, setting up many areas to accommodate social distancing, and running errands anywhere and everywhere, in the words of one of their colleagues. They even jumped in to help with tasks outside their usual job description, like delivering food donations throughout the hospital. We want everyone on the facilities team to know how deeply grateful we are for their can-do attitude under these challenging circumstances. They are true healthcare heroes, and we could not have managed the peak of the pandemic volume without them.
Wow. 14,000 plus employees work across the UMass Memorial Health Care system, from the Medical Center to the Health Alliance Clinton and Marlborough hospitals to Community Health Link. And as you saw in the videos, and you'll see in others later tonight, it takes a village to serve the community. Now is the time to give, and your donations help support everyone across the system. Bid on some of our wonderful auction items, or just pledge any amount by clicking the donate button. Everything you do can help us make a difference. If you've attended the Winter Ball in the past, you know that ordinarily we would all be gathered in beautiful Mechanics Hall right here in downtown Worcester. Well, you know what? We're about to transport you there just for a moment, along with the music by acclaimed violist and Worcester Chamber Music Society founding member, Mark Berger.
Mechanics Hall misses your celebration this year. It's best to fill the hall with beautiful music. To all caregivers, masked and unmasked, thank you.
Hi, I'm Anthony Consigli with Consigli Construction.
My name is Sue Mailman and my company is Coughlin Electrical Contractors.
We support UMass Memorial Health Care and the Winter Ball because it's the primary fundraising mechanism for the hospital. And the hospital has been such a central point in our employees' lives. It's where everyone comes for care.
As an employer in Worcester, I think it's really important that we support our institutions. It's an honor and it's a privilege, and I know that the health care that is provided here is taking care of my friends and neighbors and employees.
I've had family members get cared for here. I've had lots of my coworkers get cared for here. And I know that makes the whole healthcare experience just much, much better.
And as a community member, there's a lot of work that I do associated with not-for-profits, for community colleges, for education, and I know that UMass is very embedded in the community, and we need them because, frankly, we need everybody to do their part.
We would encourage everyone to support UMass Memorial Health Care Winter Ball because in order for the hospital to keep advancing, to keep growing, and to keep doing the great work that they do, they need financial support, especially in a year like this year. We had a few employees who live in Worcester who came down with COVID during the pandemic, and it was nice having the confidence and being able to go to bed at night knowing that they were going to be well cared for. Our employees are like family to us, and I'm so proud of the work that the caregivers here at the hospital provide.
It takes a village, and I think that UMass has given to the community, and I think that the community needs to give back. And I've seen what has been able to be done with some of the special events that happens from the Winter Ball, and those are really special initiatives that help our community after the event. Coughlin's has been involved for many, many years, and I hope that we can continue that as long as possible. I'm happy to be part of recognizing the work that gets done by UMass Memorial in the community.
Thank you to Mark and to our amazing donors. Thanks to supporters like you, we entered this evening having raised $750,000. If you scroll through the auction items on your mobile bidding website, you'll see that several items represent donation categories for tonight's Fund-A-Need. They range from $100 to $10,000. We hope you'll go as big as you can. You can also choose for your own amount to give. This year's Fund-A-Need is directing your dollars to one cause, the Emergency Assistance Support for Employees Fund, better known as the EASE Fund. During this COVID-19 era, we are all facing new and unexpected challenges. For some, it has had a significant financial impact, making it harder to make ends meet. Should a caregiver experience an unexpected personal emergency, like childcare needs or a spouse losing their job, help is available through the EASE Fund. Eligible employees can receive an EASE grant for up to $1,500. The number of applications for assistance has tripled this year, with the funding needs increasing from less than $10,000 per month to more than $40,000. Help us help our caregivers by supporting this fund. 100% of your Fund-A-Need donations go right to the EASE Fund. If you have $100, awesome. Imagine what $1,000 could do for a caregiver facing a hardship right now. Let's get donating while you watch this story about Venton and see this inspires you to give.
UMass Memorial Health Alliance Clinton Hospital is a community of caregivers, and every one of us has the opportunity to make a difference to a patient and a patient's family every day. Sometimes it's the little things that loom memorably large. That's what happened for the family of a 55-year-old woman with terminal cancer, and one of her children was moved to reach out and publicly share the story. When my mother lay in a hospital bed with terminal cancer, her favorite person was not her doctor, or a nurse, or a medical technician. This family member wrote, her favorite person was the man who came into her room each day with a smile and a joke to make her laugh. Her favorite person was a member of the hospital's housekeeping staff. That was houseworker Venton Beckford, and although the family member did not remember Venton's name, the memory of how Venton made the patient feel will be with the family forever. I remember that in his presence, she forgot her circumstances for a moment. I remember how much my family appreciated this man and how his humanity shone like a light that bathed my mother in peace for a time. I hope I thanked him. I'm not sure I did. I was in such pain from watching my mother slip away that I may have missed my chance, but I am thanking him now. And we thank you, Venton, for keeping your focus on our patients and their families, for sharing your compassion and humor in the midst of difficulty and grief. To you, it may feel like you're doing your job. To this family and others, you're a healthcare hero.
Truly amazing. Thank you, Venton, for being a champion. I want to tell you a little more about the EASE Fund, because the word ease really tells a story. A financial grant does more than help employees pay the bills. It helps to relieve the worry and anxiety that comes with a crisis or unexpected expense. I hope there are some of you out there that can give at the $10,000 level. The EASE Fund does so much. It helps employees get back to bringing their whole selves to their jobs again, and that's what they want to do. How about clicking on that 5,000 Fund a Need square? You'll be making an enormous impact on hard-working caregivers. Let me tell you about Joanna. Joanna started working in the ER at the UMass Memorial main campus last winter. And when caregivers were being offered overtime after COVID hit, Joanna took every shift she could. This single mom became known among her coworkers, not just because she was always on duty, but because of her cheerful disposition. Her colleagues loved her for it. But one day, Joanna didn't show up at work. There had been a fire in her apartment building. No one was hurt, but Joanna's apartment became unlivable because of a water damage. She had to replace everything, from mattresses to electronics to all the food in her pantry. Joanna had to take a few days off from work while the apartment was cleaned. She wondered how she could replace everything, especially her 12-year-old son's computer. His school was fully online, and he'd already lost a week of classes. Meanwhile, coworkers reached out to her because she'd never missed a day of work. She should have been surprised by their concern, but she was. Getting her EASE Fund grant and being able to replace her son's computer was an incredible relief, allowing Joanna to keep working hard, to keep showing up fully for her patients and her colleagues. Your gift of $2,500 will help other caregivers like Joanna. These are the people UMass Memorial depends on. They're the people we in the community depend on. Go to the mobile auction site, scroll down through the items, look for the Fund a Need squares, and choose your amount. Francis is another caregiver who benefited from the EASE Fund. In his second year as a nurse, he was adjusting to the stresses and challenges of the pandemic just like everyone. Then one day he lost his wallet and all the cash inside. He was devastated and struggled to pay his mortgage. Also, he lost the only 2 pictures he had of his mother who had passed away. When Francis applied for and received the EASE grant, everything changed. I realize my employer cares about me, he said. Money is important, but there is more to a job than a paycheck. I want to work for an employer who will be there for me. And Francis will be there for his patients. He feels proud to work at UMass Memorial because the organization understands that employees who face financial difficulties simply cannot perform at their best. So we're asking you to please give generously to the EASE Fund. Help us help people like Joanna and Francis, dedicated, hardworking caregivers facing unexpected challenges. The need has never been greater. We're going to pause here for a Fund a Need check-in, and it looks like you've been inspired, and now we are at $105,400. Great job. Thank you so much for supporting the EASE Fund and being a champion for our caregivers. Keep in mind that you'll have until Monday at noon to donate, so keep that generosity going. Now, let's take a look at some other caregiver stories.
Early in the pandemic, when the spread of COVID-19 in New York City seemed unstoppable, Dr. Yoel Carrasquillo-Veja, Director of Hospital Service at Marlborough Hospital, was called to serve by the Army Medical Reserve. Traveling to New York, he jumped right into the middle of the chaos, the heartbreak, and the unknown to join the coronavirus fight. Back in Marlborough, the staff was proud of his commitment to duty, to serving the country, but we missed him too. The case management department put together a slideshow of photos of coworkers to keep up his spirits and let him know we were thinking about him while he was away. We held signs in English and Spanish, reading, "COVID-19 will not break our spirit. Te echamos de menos, and you are not alone," while the song "Lean on Me" played in the background. That's what family does when one of their own is putting himself at risk for the sake of others, especially someone like Dr. Carrasquillo-Veja, who is passionate about providing great patient care and whose kindness and leadership have made him a widely respected colleague throughout UMass Memorial Health Care. Thank you, Yoel, for sharing your skill and compassion with those who needed it most, and for coming back safely to rejoin your Marlborough Hospital family and get right back to delivering on our promise of the highest quality care for our community. UMass Memorial Health Alliance Clinton Hospital was well prepared for the surge of COVID-19 patients in the spring. We had enough personal protective equipment, we reconfigured space to more than triple the number of isolation rooms available for COVID patients, and everyone was ready. But there was one element of the pandemic peak we hadn't really planned for: the tremendous outpouring of community support in the form of donated meals and snacks. While incredibly grateful to the community for wanting to take care of the caregivers, the hospital faced quite a logistical challenge to distribute the food, some of it literally perishable the same day it was dropped off. Jamie Coolidge, usually working behind the scenes as Director of Food and Nutrition Services on our Leominster campus, stepped right up, rallying her team to take on the wonderful but challenging new task of making sure every caregiver received a snack or a meal whenever possible. Working across 3 campuses, 3 shifts, and more than 1,000 deserving caregivers, Jamie made sure that the community's generous donations made their way to everyone, even if that meant personally doing rounds at 2 a.m. to deliver food and boost the spirits of the 3rd shift. Thank you, Jamie, to you and your team for your commitment to supporting all of us at Health Alliance Clinton Hospital in our goal of providing the best care every day to every person in our community. We're proud to salute you as a healthcare hero.
Truly amazing stories of our caregivers. Thank you, Yoel and Jamie, for being champions. Let's look at how some of our auction items are doing so far. All right, the road trip down south is at $2,000, but the ultimate Mercedes-Benz experience is almost $2,500 at $2,450. But it looks like everybody wants to go to the Dixons because we're over $4,000 on that item right now. We also want to remind you that mobile bidding is open throughout the evening and stays open through Monday at noon. Now, while you've all been bidding on those mobile auction items, I know you've also been waiting for the big ticket items. Well, those live auction items are open and going strong, and you only have about 30 minutes to bid because we will close those items at 7:20. All right, here they go. The first item, an amazing road trip for a family of 4 starting in the charming city of Charleston, South Carolina, and ending in Savannah, Georgia. You'll pick up your rental car in Charleston and enjoy 2 nights at the beautiful Belmont Place Hotel. This city has so much to offer. Then you'll drive to Hilton Head and spend a night at the Omni Hilton Head and see the sights that Hilton Head offers. After enjoying both Charleston and Hilton Head, you'll make your way down to Savannah, Georgia, and spend 2 nights at the Kimpton Bryce Hotel in Savannah. After all that driving, you'll be treated to lively walking tours of these charming historic cities. Next up, the ultimate Mercedes-Benz AMG race car driving experience in California. This is a performance training driving experience of a lifetime, and it comes with a 4-day, 3-night stay for two at the nearby Carmel Valley Ranch, voted the #1 resort in Northern California. You'll also get $500 to spend on a round of golf, spa treatments, and fine dining as part of this unique package. But best of all, you'll have until 2024 to make the trip. Next up, I love this one. You and 11 guests will enjoy a personal Oktoberfest experience on the Dixon family farm. This priceless package is for 12 guests to join Dr. Dixon and his wife, Dr. Catherine Jones, for an unforgettable evening under the stars. You'll enjoy a 3-course meal, craft beers, a campfire, Oompa music, and horse cart rides for the daring, plus a swag bag with Dixon Farm maple syrup and raspberry jam. Next up, dinner for 12, right along the infield at the new Polar Park during the inaugural season of the Worcester Red Sox. You heard about dining on the Diamond in Pawtucket, but this dining experience has never been offered before. You and 11 guests will enjoy a gourmet meal in an elegant setup, plus a private tour of the park. And finally, this fantastic 1-week stay in a charming stone house in the countryside of France. Set in the center of a medieval village with restaurants, galleries, and shops, your home away from home is high on a cliff overlooking the Lot River with spectacular views from 2 terraces. It's a trip for 6, ideal for a family or 3 couples. And note, you can book your stay in 2021 or 2022. There is something for everybody, and please take home what you want. Let's throw it back to Hospital President and CEO, Dr. Dixon.
Now I'm pleased to introduce a good friend, supporter, and advocate for UMass Memorial Health Care, and a hometown favorite of ours. Please welcome Lieutenant Governor Karen Polito.
Hi, I'm Karen Polito, Lieutenant Governor, and proud supporter and friend of all things UMass Medical Center. It is an honor and a pleasure to be with all of you tonight for your 12th annual gala, and we have had so much fun over the course of the years getting together to celebrate the accomplishments and the great work that all of you do at Team UMass Medical Center. Tonight feels different for sure, but nonetheless, it is an opportunity for us to express our gratefulness and our thanks for the caregivers of the UMass team. Let me first start by saying how proud I am as a lifelong resident of Central Massachusetts and as your Lieutenant Governor, as I have witnessed the incredible efforts and devotion of all of you at UMass for giving and caring for the people of our community. When I think about you as caregivers, and we are celebrating you tonight, you are many times our unsung heroes. You're the ones that we always rely on to just get up, go to your job, and care for the people who come your way. And tonight is an opportunity for us to just pause on that moment and truly say how grateful and thankful we are to have caregivers as courageous and as devoted as all of you. And let me just go one step further to say not only thank you to you for being there for us, but to your families at home, the ones that you would go home to after a day in the hospital, caring for people with COVID and other conditions without question. So thank you and your families for all that you've given to us. Let me also say a thank you to Dr. Eric Dixon. Dr. Dixon, Eric, is also one of our unsung heroes. Now, at the beginning of the pandemic, when we were talking about UMass, there was one thing I just wanted to note about Eric. He said, "We can do this. We're built for this." And I truly saw that you are built for this. But the reason he could say that is because he believes in his team. He believes in every caregiver that is part of the UMass Medical Center team. And he knew he could rely on you to deliver on the promise of making sure that UMass was ready to handle the cases involving COVID that would come your way. So we are so grateful to Eric for taking the lead, for your team being there for all of us. You know, whether it's tackling the opioid epidemic or tackling the problems associated with the pandemic, there is no question that Eric and the team were ready for this task. I also want to thank you for being first to set up a field hospital in Massachusetts early on in this pandemic. Another moment when Eric and team said, we can do this, we're built for this. And then of course, just recently, Dr. Dixon came to Boston for the announcements with Governor Baker to set up field hospitals in this surge time of the pandemic. And again, Worcester standing up as the first to set up a field hospital at this time. I just want to say thank you, how proud I am. Thank you for your courage, and thank you for all that you are able and willing to do. We are eternally grateful. So at this time of the gala, we express our thanks, but we also understand how important you are to the health and well-being of many citizens of our Commonwealth who rely upon you and appreciate you. Be safe, be well, and have a good celebration tonight.
Over the course of a week in April, 50,000 square feet of empty space in Worcester's DCU Center was turned into a 214-bed field hospital for the care of patients with COVID-19. A partnership between the state of Massachusetts, the city of Worcester, and UMass Memorial Health Care, the field hospital was opened on April 9th and admitted its first patient that afternoon. Standing up the field hospital in just 8 days and overseeing its operations fell to 3 UMass Memorial caregivers: Dr. John Broach, Chief of the Division of Disaster Medicine, Sharon Rudnitsky, who filled the role of Nurse Manager, and Pete Lancette, Associate Chief Nursing Officer. The field hospital was outfitted with all the critical care equipment for monitoring and treating COVID patients, a sophisticated system for dispensing medications, a call system allowing patients to alert nurses at any time, and even ADA-compliant supplemental bathrooms and mobile shower facilities. Ultimately, more than 250 people were cared for at the field hospital. The effort to install everything from a fully functional electronic health record to a portable X-ray machine was truly heroic. To John, Sharon, and Pete, and all of our caregivers who are part of this incredible undertaking, thank you for your tireless work creating a hospital under extreme time pressure and operating it in stressful and uncertain circumstances. We're proud to honor you as healthcare heroes, and we are grateful for all the clinical and non-clinical caregivers involved in the DCU Center Field Hospital for their dedication to keeping our community safe. Thank you.
Tremendous leadership and vision. Thank you all for preparing our community for the care it needs in these very difficult and uncertain times. We're grateful to Governor Baker and Lieutenant Governor Polito for their incredible support as we prepare to open the UMass Memorial DCU Center Field Hospital this weekend to support the state's care of COVID patients during this second surge. The field hospital will be able to care for up to 220 patients, all who need additional treatment for COVID-19 but do not require ICU-level care. It will have upgraded equipment and additional space for patients to walk around. As Dr. Dixon said this past week at a press briefing with the governor and the lieutenant governor, we don't want this to be the second stage, Dixon said. We want this to be the final stage. Again, that's why we're gathered here tonight. So let's check in on the progress of your contributions. Well, folks, I'm looking at some of them right now, and things are moving. You're starting to get the hang of it, so thank you so much. We're just over the halfway point of our show, and it's really flown by, and yet we still have so many stories to share. Check these out while you continue to bid on those live and mobile auction items.
To stay safe in the time of COVID-19, we're all masking up, keeping distant, doing our part to stop the spread. And some of us are doing even more, much more. Houseworker Jennifer Walker, a second shift caregiver, was assigned one of the most difficult duties during the pandemic, COVID discharge room cleanings. It's not just hard work, it's stressful, and it has to be done with precision. According to Jennifer's colleagues, she's known for her attention to detail and her positivity, and she dove into the new assignment without hesitation or complaint. Little did her colleagues know how brave a face she was putting on. Jennifer often spent her break praying in the meditation room, but one day in early May, she seemed to have a heavy heart. A manager made an effort to console her and learned that Jennifer had lost 2 close family members to COVID-19 within just a few weeks of each other. And yet, she had not requested any time off. I know the patients need me to keep them safe, Jennifer explained. We're all in this together. Her response resonated deeply with the entire management team. Thank you, Jennifer, for your selflessness and compassion for our patients. You truly exemplify our motto, everyone, every day. Sometimes the work of our healthcare champions starts small and expands to have an impact far greater than any could have anticipated. Dr. Jonathan Gerber wanted to save a critically ill COVID-19 patient. Dr. Justin Makel hoped he might help a friend. Both were there at the beginning of what has become a major research project looking at the effectiveness of convalescent plasma in treating life-threatening COVID-19 infections. Dr. Gerber was the first to use this treatment in Massachusetts, and Dr. Makel was one of the first to donate his blood so the plasma could be separated for transfusion. Dr. Makel had recently recovered from COVID-19 when he heard about a close colleague who was critically ill with the disease in April. He decided to donate his antibody-containing plasma and got in touch with Dr. Gerber, who at that same moment had been working on launching the treatment program. Speed was of the essence. On April 16th, Dr. Makel donated his plasma at the American Red Cross, and on April 18th, that first patient was treated with convalescent plasma and quickly improved. Nearly 170 severely ill patients with COVID-19 across the UMass system have been treated so far on Dr. Gerber's clinical protocol. The clinical trial is ongoing and analyses of the data are underway. Additionally, 2 outpatient clinical trials of convalescent plasma for COVID-19 are now open in collaboration with Johns Hopkins and supported by the Department of Defense to treat patients early on in their disease or to prevent the infection in exposed individuals at all. Dr. Gerber is about to open a National Institute of Allergy and Infectious Disease clinical trial, which will be the first such trial to treat patients with hyperimmune globulin, a concentrated antibody preparation against COVID-19. Dr. Gerber and Dr. Makel, thank you for your relentless efforts to deliver a potentially life-saving COVID-19 treatment to the UMass community. You are true healthcare champions here at home, and your work may well be felt throughout the world.
The unmasking of our champions appears to be working, as we are currently have raised over $776,000. Thank you to Norm Peters, Michael and Marie Angelini, and Ed and Don DeLeo for their $5,000 Fund a Need donations. Now I know you have more in you, or maybe you haven't donated just yet. Time is running out, so get your final bids in or consider the Ease Fund a Need targeted donation. Need a moment to focus on donating? Here's your chance. We've got the hottest songwriter in Nashville here with us tonight. Her songs have been performed by Tim McGraw, Little Big Town, Carrie Underwood, and Keith Urban. Even Lady Gaga has written with her. Well, that songwriter is a lifelong Massachusetts resident, and she joins us tonight with a special performance of one of her Grammy Award-winning songs, Humble and Kind. Take it away, Laurie McKenna.
Hi, everybody. My name's Laurie McKenna. I'm a songwriter and a lifetime Massachusetts resident. I live here in Stoughton, Massachusetts with my family, and we're so happy to be here with you tonight. To the caregivers, the masked and the unmasked caregivers, we thank you so very much. And to the people watching at home, we want to thank you for your donations and let you know that your donations make a big difference in the care that UMass Memorial can provide. I'm going to sing you a song that I wrote in this little house and sent to my friend Tim McGraw, and he really brought this song to life, and I wanted to share it with you tonight. Thank you for having me, and here's a little bit of Humble and Kind. You know there's a light that glows by the front door. Don't forget the key is under the mat. Where childhood stars shine. Always stay humble and kind. We'll go to church 'cause your mama says to. Visit grandpa every chance that you can. It won't be wasted time. Always stay humble and kind. Oh, the door, say please, say thank you. Don't steal, don't cheat, and don't lie. I know you got mountains to climb, but always stay humble and kind. When those dreams that you're dreaming come to you, when the work you put in is realized, let yourself feel the pride, but always stay humble and kind. Don't expect a free ride from no one. Don't hold a grudge or a chip, and here's why. Bitterness keeps you from flying. Always stay humble and kind. And know the difference between sleeping with someone and sleeping with someone you love. I love you ain't no pickup line, so always stay humble and kind. Oh, the door, say please, say thank you. Don't steal, don't cheat, and don't lie. You know you got mountains to climb, but always stay humble and kind. And when those dreams that you're dreaming come to you, when the work you put in is realized, let yourself feel the pride, but always stay humble and kind. Yeah. So when it's hot, eat a root beer popsicle. Shut off the AC and roll the windows down. Let the summer sun shine. Always stay humble and kind. And don't take for granted the love this life gives you. When you get where you're going, turn right back around and help the next one in line. Always stay humble and kind. Thank you, guys.
Community Health Link is committed to providing services to the most vulnerable, and our staff steps up to make that happen, often in remarkable ways. During the COVID-19 pandemic, Atai Udofia, a clinician with Passages, our residential treatment program for individuals in the early stages of substance abuse recovery, exemplified this willingness to go above and beyond. Although his position with NCHL is a clinician, he volunteered to come in as a certified nursing assistant to work with COVID-positive clients in our inpatient unit. Atai could have stayed home, but he has the CNA certification and knew that clients on the floor needed that care. So he offered his time and skill, working in the CNA role, shoulder to shoulder with staff and clients. Thank you, Atai, for putting clients first as a healthcare champion.
There's our 1-2 combo, the song Humble and Kind and the amazing kindness of Atai. This is why you give. And let's check in and see how the Fund a Need is doing. We're at $119,000, but I know we got more in us. So thank you again. Well, it's just about time to close the live auction. You have just minutes left to place a bid. Let's check in on the status. And the Mercedes race car experience is taking off at over $8,000. Followed in second place by Dr. Dixon's Oktoberfest at $6,550. Dinner on the Diamond has jumped up to $3,600, but I want to know why we are not bidding on the week stay in France. Gentlemen, this is a fabulous way out of the doghouse. Come on, gang, let's keep going. You also just saw the piece recognizing the spirit of giving from our sponsors. Again, we want to thank those companies and individuals making significant donations to the hospital.
Thanks, John. Wow, that was an incredible night. And that is because of you. I hope you enjoyed your time with us this evening as we unmasked our champions, enjoyed some great musical performances, and what would the Winter Ball be like without John Terrio and our live auction? I would like to thank Lieutenant Governor Polito for her kind words and the leadership and support she and Governor Baker have provided during this pandemic. A big shout out to Mark Berger and Laurie McKenna for sharing their musical talent with us tonight, and to Ray Green, who you will hear from in just a few moments. And finally, I want to thank all of you. Whether you are watching this live or watching it later when you have time, I'm grateful for your continued support and for standing by us. You helped our caregivers to stand strong during the biggest challenge of our lives, and for that, I will always be grateful. Have a good night, and please stay safe.
Thank you, Dr. Dixon. Well, it's official. The live auction has closed, and the winners will be announced shortly. But the evening hasn't concluded. We hope we've given you a glimpse of the work of our awesome healthcare champions and the enormous contribution the UMass Memorial Health Care system makes in our community. Our champions are ordinary folks doing extraordinary work, and they are all committed to providing you with the best possible experience every day. We have the incredible Ray Green, who will perform in a few minutes, and while the team behind the scenes is tallying up the amount raised for the EASE Fund so far, I can share the amount raised from the live auction. Thank you so much for your support. Let's reveal the work we've achieved tonight. Drum roll, please. So far, ladies and gentlemen, we just surpassed $800,000, and we're at 803 with a Fund a Need of 139 so far. And don't forget, we are still raising funds until Monday at noon. This is truly a special night to celebrate. Thank you for your contributions. Thank you for attending. But wait, the night doesn't have to end just yet. We have one last musical performance to present. and maybe you'll dance and sing along. Please welcome the lead singer of the legendary group Santana, Ray Green. Thank you, everyone.
Hi, I'm Ray Green, and I'm a Massachusetts performer, and when I'm not on COVID lockdown, I'm the lead singer for Carlos Santana. And this is my good friend, Mr. Johnny Keys. Thank you for your donations, and thank you to all the caregivers. Now let's end this phenomenal evening with some music and make it a celebration. Hey, come on everybody. Come on, Winter Ball. Put your hands together. Let's have a good time. I got this feeling inside my bones. It goes electric wavy when I turn it on. All through my city, all through my home. We flying up no ceiling when we in our zone. I got that sunshine in my pocket. I got that good soul in my feet. Got that hot blood in my body. When it drops, ooh, I can't take my eyes off it. Moving so phenomenally. You won't like the way we rock it, so don't stop. And then under the lights when everything goes, nowhere to hide when I'm getting you close. When you move, girl, you already know. So just imagine, oh, nothing I can see but you. When we dance, 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 feeling good, good creeping up on you. So just dance, dance, come on. All those things I shouldn't do, but you dance, 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 and ain't nobody leaving soon. So keep dancing, can't stop the feeling. So just dance, dance, can't stop the feeling. Just keep dancing, oh, ooh, it's something magical. It's in the air, it's in the blood, it's rushing on. I don't need no reason, I don't need control. I fly so high, no ceiling when I'm in my zone. Cause I got that sunshine in my pocket. I got that good soul in my feet. Got that hot blood in my body. When it drops, ooh, I can't take my eyes off it. I'm moving so phenomenally. Won't like the way we rock it, so don't stop. But then under the lights when everything goes, nowhere to hide when I'm getting you close. When you move, girl, you already know. Just imagine. Come on, y'all. Nothing I can see but you when you dance, dance, dance. Good, good creeping up on you, so just dance, dance, dance. All those things I shouldn't do, but you dance, dance, dance. And ain't nobody leaving soon, so keep dancing. Can't stop the feeling. So just dance, dance. Can't stop the feeling. So keep dancing. I can't stop the feeling. Come on, I keep dancing. I can't stop the feeling. Come on, Winter Ball. Everybody, sing it with me tonight. I got this feeling in my body. Come on, sing it. I got this feeling in my body. Come on. I wanna see you move your body. Come on, Winter Ball. I got this feeling in my body. Come on, one more time. I got this feeling in my body. I got this feeling in my body. Come on. I wanna see you move your body. Winter Ball. I wanna see you move your body. Hey, I got this feeling in my body. I got this feeling in my body. One more time. I wanna see you move your body. I got this feeling in my body. Come on. Thank you, Winter Ball. Peace. So much positivity to find in these times. And that's what Winter Ball is all about. Celebrating. gonna know how to handle it. Always reaching out in vain, just taking the things that worth having. Don't you worry about a thing. Don't you worry about a thing, mama. 'Cause I'll be standing on the side when you check it out. Oh, you say your style of life's a drag, and that you must go other places, but just don't you feel too bad when you get through my smiling faces. Don't you worry about a thing. Don't you worry about a thing, pretty mama. 'Cause I'll be standing on the side when you check it out. When you get off your trip, don't you worry about a thing. Don't you worry about a Everybody needs a change, a chance to check out the new. But you're the only one to see the changes you take yourself through. Don't you worry about a thing. Don't you worry about a thing, pretty mama, no. 'Cause I'll be standing on the side when you check it out. Oh, don't you worry about a thing. Don't you worry about a thing. No, no. Don't you worry about a thing. Don't you worry. No, 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 no. Don't you worry about a thing. Yeah.
I look forward to performing live in front of actual crowds. I imagine while this broadcast is awesome, you look forward to a winter ball next year in person. I hope I can join you.
When I wake up in the morning, love, sunlight hurts my eyes. Then something without warning, love, weighs heavy on my mind. Then I look at you, and the world's all right with me. Just one look at you, and I know it's gonna be a lovely day. A lovely day. when the day that lies ahead of me seems impossible to face, then someone else instead of me always seems to know the way. Then I look at you and the world's all right with me. Just one look at you and I know it's gonna be a lovely day. It's gonna be a lovely day. Lovely, lovely, lovely day. Then I look at you and the world is all right with me. Oh, just one look at you and I know it's gonna be a lovely day, lovely day, lovely day, lovely day, lovely day, lovely day, lovely day. It's gonna be a lovely day, lovely day, lovely day, lovely day, lovely day.
Thank you again for watching. Here's one last song. And if you haven't danced at home yet, here we go, Winter Ball. Listen, baby, ain't no mountain high, ain't no valley low, ain't no river wide enough, baby. You need me, call me, no matter where you are, no matter how far. Don't worry, babe, if you call my name, I'll be there on a hurry. You don't have to worry, 'cause baby, there ain't no mountain high enough, ain't no valley low enough, ain't no river wide enough to keep me from getting to you. Remember the day I set you free, I told you you could always count on me, dog. From that day on, I made a vow that I'd be there when you want me some way, somehow. Ooh, ain't no mountain high enough, ain't no valley low enough, ain't no river wide enough to keep me from getting to you, babe. No wind, no wind, no rain, oh winter storm can't stop me, baby.
to keep